All right. Good afternoon. Thank you for joining us. I am Kathy Reback, and I am the director of the Combination Prevention Core at UCLA CHIPTS. We're very, very happy that you are joining us today for this webinar on homelessness, being unhoused in LA County. Why is it so hard to get people housed in Los Angeles County? This is the second part of a three-part webinar. The first part focused on HIV, mental health disorders, and substance use disorders. The webinar today is focusing on harm reduction strategies. And the final third webinar, which we will have later this year, is going to focus on policy and solutions. If you have any questions during the course of the webinar, feel free to put them in chat. We will go through the webinar and the presenters and get to the questions after such, but we will certainly look through the chat for your questions as they come up. And at this time, I would like to turn the webinar over to our moderator for today, Dr. David Goodman.
Hi, everybody. Thank you, Kathy, for passing it along. I'm David Goodman-Meza. I'm an assistant professor in the Division of Infectious Diseases here at UCLA. And as many of you here, my work is at the intersection of substance use disorders and infectious diseases, and specifically HIV. I'm really excited to be here moderating this panel by CHIPTS, where we're going to actually hear the voices of people who are doing this frontline work related to harm reduction, and especially in preventing HIV. But now with the current drug overdose epidemic that we're living in, harm reduction really encompasses much more than HIV prevention and overdose prevention and many other pieces in the health of people who use or inject drugs. So first off, I'm going to pass the spotlight over to Ricky Rosales.
Thank you, David. Hi, everyone. My name is Ricky Rosales. I work for the City of Los Angeles in the AIDS Coordinator's Office, and I serve as the City AIDS Coordinator. So I'm going to take you through just a brief overview of the work that the office is doing in harm reduction. Very quickly, the office was established in 1989 by Mayor Tom Bradley. One of the things that we always wanted to do in the office was stay on the cutting edge of HIV prevention and care. One of the things that sort of led to us doing harm reduction here in the city was this idea that we needed to do things that nobody else was doing. We wanted to make sure that we were innovating, that we were staying in front of the HIV epidemic, not chasing after it. In terms of the harm reduction work, the syringe exchange program for the city has been operating for over 25 years at this point. Of course, everybody here knows that syringe exchange programs slow the spread of HIV. They do not contribute to more drug use, and they facilitate drug users into treatment, housing, and other services. 1994 was the year that the city declared a local health emergency that directed all city departments to take all necessary steps to allow the service of syringe exchange to exist in the city. Of course, there were no laws that allowed it back then, so we had to get creative. Doing this back in 1984 really allowed us to keep rates of HIV among injection drug users low in Los Angeles as compared to other cities in the nation and around the world. One of the things that we wanted to make sure to do was to build a strong foundation for this program so that people can sorry, there's people laughing in the background. One of the things that we wanted to do was to make sure that we built a foundation so that nobody could come in and sort of pull the rug from under us and slow us down in terms of growing this program. So we made sure that we talked to the mayor's office. We got the support of the mayor's office, the city council. We got buy-in from all the departments. And then once we established the connections with the nonprofits and community partners, we made sure that the business side and the people who lived around the sites that we were going to open knew what the program was. They understood why it was important, and that we had their support. And on top of that, we had to make sure that LAPD wasn't going to come and interrupt these services. So we made an agreement with them back in 1994 that laid out a set of rules around syringe exchanges that would allow us to function without them coming in to arrest our clients or arrest the people who are providing the services. And we continue to have to renew that agreement with every chief of police that comes in and has come in over the years. A few of the ways that the services are provided, mobile-based. Some of them are in vans, some of them are in cars. Some of the organizations have RVs that they use. It just depends on how big the organization is and how much resources that they're able to have for this program. We have a few storefronts. Again, those are sort of based on the size of the organization and their capacity to raise funds to pay for all the services and efforts that go into these storefronts. And the most recent thing that we started doing a couple of years right before COVID was we allowed the agencies to do backpack syringe exchange, so they could go into encampments, they could go on the streets while they're doing outreach and provide sort of minimal services and connect them to sort of the rest of the services that they would have on site or in their mobile units. In terms of the services that are provided, any of the services that any of the providers on this meeting do, we have a connection through the providers that we have here, either directly in their agencies in-house or through referrals through their community partners. In terms of the connection to housing, we've known for a long time that the majority of our clients coming to use these services are unhoused. So we knew that we had to have some sort of connection to the services that the city is providing for housing unhoused individuals. And that ranges from our winter shelter programs to our HOPWA program to the safe parking programs that were started during COVID, the partnership with libraries, and most recently the Inside Safe program that Mayor Bass started. A couple of areas that we've tried to sort of innovate into over the last couple of years. The first one, we started tracking overdoses. This is not a data point that we were collecting 3 years ago. We really started doing this 2 years ago when we started seeing the overdoses go up. More people were talking about it. We got a lot of interest from the city council and the mayor's office. And so we worked with our partners to start collecting that information, in addition to starting the overdose prevention trainings and the provision of naloxone and the fentanyl testing strips that's happening out there now, sort of on the regular. Another area that I just mentioned is actually the Inside Safe program. We are connected to the Inside Safe program. We are active in the meetings and the planning meetings that go into the efforts. Really, the program is about targeting different areas around the city with large encampments. We go in there with a myriad of partners that offer all types of services, and we connect them to those services, and then we tell them, do you want to be housed tonight? And we can get them into a motel room, a hotel room, or other sort of facility that the city is either leasing or is in the process of purchasing. So far, we've been very successful at getting almost every single person that we connect with in those encampments into housing. The nice part about this is that there is really no restrictions on who can be in that program. So we don't restrict people who are active drug users. We don't deny anyone the service. If someone says, yes, I'm willing to go, we let them into the program. And as of right now, there is really no time limit on how long they can stay in there. Our goal is to get them housed and then get them the services that they need to stabilize them and then get them into long-term housing. In terms of some program highlights, and I swear I'm almost done. Over the last full fiscal year, which was 21-22, we're still in the current fiscal year, so I don't have the full numbers for this fiscal year. We saw 35,000 unduplicated clients, Over 14,000 of them were unhoused individuals. We collected over 2.1 million syringes from city streets. We trained 7,200 individuals in overdose prevention. 6,000, we had 6,000 reported instances of overdose reversals, and we distributed over 22,000 fentanyl testing strips. And then in terms of breakdown, demographic breakdown, the majority, 75% of the clients that come into these services are male, 75%, followed by female, 24%, and 1% for the transgender community. And we don't have a breakdown on the transgender community. Sorry about that. In terms of race ethnicity, the majority are white individuals, 45%, followed by Latinos at 30%, followed by African Americans at 18%, and then Native Americans, mixed race, and API are all at 1%. And I will leave it at that. Thank you.
Thank you very much, Ricky. It's always a pleasure to hear you talk, and it's always been a pleasure to collaborate with you. Next up, we'll have Ellie Jolier from Vienna Star give us her perspective.
Thank you, Dr. Goodman. Hi, everybody. My name is Ellie Jolier. My pronouns are she, her. I'm the harm reduction program manager here at Vienna Star Human Services. I'm a person who uses drugs and someone who's been doing harm reduction in some capacity the majority of my life. Vienna Star is a community-based social services organization serving Los Angeles County. Our focus populations are the Latina, LGBTQ population, people who use drugs, as well as the broader scope of marginalized people. Our agency was founded in 1989 in direct response to the resources available to our priority populations at the height of the HIV/AIDS epidemic. Many of our services here at Vienna Star are to engage people living with or at a heightened risk of contracting HIV. Our HAPO housing program provides transitional housing for people living with HIV. Our Transformando Vidas and our Medication First programs provide individuals with short-term hotel vouchers. For our MOUD Medication First program, the hotel vouchers help with retention to treatment, providing a safe, warm space to start their pharmacological therapies. We have a robust harm reduction program here that provides full scope risk reduction materials such as safer use supplies, naloxone distribution. We do overdose prevention response training, drug checking, and rapid HIV Hep C testing. Our clinic at Vienna Star offers medication for opioid use disorder, wound care, STI testing treatment, PrEP, PEP, and antiretroviral therapies. We offer an array of external referrals to social and medical support services based on our participants' needs. And through our collaboratives with Alma Family Health Services, their LEAD program, PATH, local shelters, and other coordinated reentry systems, we've been successful in linking our harm reduction participants to long-term housing. That's not to say that there aren't major limitations, challenges, and barriers when connecting our participants to housing services for us as providers, for the participants, and for their care communities. What makes us unique from other service providers is that our clients and our harm reduction centered, culturally competent approach. All our services here at Vienna Star are offered in both English and Spanish. We have multiple monolingual Spanish-speaking staff members. Many of our staff come with lived experience, as well as peers who at one point received our services and were so positively impacted that they ultimately developed into staff. The direct service has proven so meaningful, efficacious, and empowering that it's created employment opportunities for people who previously felt that they had exhausted their options in workforce development. Because our harm reduction program is part of a larger organization, we have the privilege of tapping into the other services our agency provides. And our goals for our harm reduction program is to be a health hub, through our clinic at Bienestar, we can directly provide a number of health services, and we're only looking to expand and deepen our engagement with our folks. Our next big push here is to provide hepatitis C treatment. Thank you so much.
Wonderful. Thank you so much for that overview of the operations at Bienestar, Ellie. And to close us out for this portion of the webinar, super happy to have Soma Snake Oil. So take it away.
Thank you, Dr. Goodman. I am Soma Snake Oil. I'm the executive director of the Sidewalk Project. And I'm so happy to be here with all of you, but I can't see you. I just see a lot of names. So anyone who wants to put on their camera, that would make me feel really happy to see some faces. But that's okay if you don't want to as well. So, I mean, first of all, I'm just so, hi, Timothy. Nice to see you. I'm just so happy to be here with all of these badass people doing such incredible work. You know, I'm a huge fan of Dr. Goodman's work. Ellie's one of my favorite harm reductionists in this county. You know, Ricky approved us to do the work that we're doing. So, you know, I think of him as, you know, one of our beginnings, and appreciate so many good years of his service to our community, and just stoked to be here with all of you. I think it's really important for us at the Sidewalk Project. You know, we're a pretty radical organization, so I want to talk about the benefits, but I definitely am excited to talk about the barriers and difficulties for our people as well. The Sidewalk Project, as I was saying, we are lived experience. That includes myself. You know, I have lived experience as a former drug user, as formerly unhoused, and I'm currently still a sex worker of, I think, about 20 years. And most of our team is, you know, that's also their experience as well, some kind of experience around these things, as well as, you know, being justice involved or having their children taken away. You know, I experienced that myself, being investigated by DCFS when I was young. As a drug using sex worker, I got reported and I almost lost my child, you know, and that's something that we see over and over again. And I honestly think that I didn't lose my child because I'm a white woman. You know, we see just the devastation to BIPOC communities, especially in that way. You know, for us, we started as the backpack syringe program that Ricky was talking about. And then we really expanded over time. And, you know, we go tent to tent and we have our carts and we use our cars. You know, we basically use anything that we can find to get to people, you know, where they're living on the streets. But then we also recently opened a day center. I'm so happy to see all your faces, by the way. Thanks for the folks that put your cameras on. So we recently opened a day center in Skid Row. And I think what's different about us is that we are really focused on gender specific services. So we are women led, and we also focus mostly on women who are using drugs and women who are engaged in sex work. And that is both cis and trans women. One of my colleagues that works with us focuses primarily on working with trans sex workers of color who are living with HIV and all of the complexities around housing for the specific population. You know, I would say it's one of our goals at some point to become a women-specific OPC with a focus on safe places to smoke. Hopefully that happens sometimes in our future, because we've been learning a lot about the evidence around how these safe spaces they're not just about overdose prevention, but they also are around violence interruption and interruption for human trafficking, which is something that is very close to our hearts, because many of us here are sex workers, consensual sex workers, or have history with consensual sex work. But we know that street-based sex workers are facing so much around predatory behavior, police involvement, you know, all of the different things that our most marginalized folks are facing. So a lot of our work actually is around domestic violence, intimate partner violence, exploitation, helping keep people get out of very dangerous situation. And that's coming from a harm reduction perspective. So, that's all of the things that we need to do to help stabilize people who are using drugs, as well as at those other intersections. And we'll talk about that a little bit later around some of the challenges that we have. But I think another aspect that's very unique about us is that we are a sex worker organization that does anti-trafficking work. And, most of the people in the anti-trafficking space are not sex worker led. So I think that that's something really, really valuable and different that we bring to the work. Maybe I'll leave it there for now. And I'm not sure who I pass it on to, but I'm really excited to have this conversation with y'all.
Well, thank you for that, Soma. Super fan of your work and of Ellie's work and of Ricky's work as well. And everybody, I see so many names that I'm really fan of what they do as well. So really to echo the joy of being in this Zoom room with so many rock stars. Next off, we'll be watching a short video clip. It's about 7 minutes. That was filmed by CHIPTS with some community members regarding their experiences with obtaining housing. And while this video is running, please everybody start thinking of certain things that are stirring your brain and things that you might be interested in hearing more from these experts that we have on the panel. So it seems like it's going to start running.
What do you feel were the reasons or circumstances that resulted in you being unstably abused?
I was taken by force from who I was, and I was put as sort of to human trafficking.
I was addicted to heroin, and that's what got me fired, and that's what led my family to not talk to me. We were like,
I fled Oregon for my life because my fiance tried to kill me 6 months before my wedding.
So intense, yeah.
And then the pandemic happened. And here we are.
Has your housing status ever impacted your ability to receive healthcare?
Yeah, paid for my insurance for a while because I thought, you know what, if I get sick, I want to make sure I'm taken care of. Then it got to the point where I ran out of money. And then I was like, okay, now I'm out of money, what am I going to do? I understood what it was like to not be able to pay for something that you want because your health insurance won't cover it.
I don't feel like the treated you differently due to your business.
And I be seeing other people being transported to other places and getting help they needed, and I'd be sitting there, they'd be going in and out, in, out, in, out, in, out, and I'd be like looking at them like, I've been waiting here for 5, 6 hours and I haven't helped. Like the other day I was at the hospital because I was in so much pain. And they didn't help me. I was there for 14 hours, just waiting.
What type of health services are most needed for people who are unhoused or unstably housed?
And I would love to see a safe spot where people can go and get their stuff, use their stuff, go home the next day. That's what I want to see. Don't treat it like it's something like that. Treat it like it's something that we something that we have, something that we have to live with. And guess what? We'll do it again tomorrow. That's all.
Mental health, wound care, general health, meds are a big thing. Vaccines, everything.
Have you received any of these services? Have you ever received needle exchange services,
Yeah.
condoms,
Yes,
Narcan,
yes,
HIV testing?
yes.
And can you describe what the process was to receive those services?
I just asked them, they said that they have made sure that I wanted to check on stuff. Which is maybe they don't got, from this, you know. But every time I come, I look at her, just in case, not for me, because thank God, I know my limitations, but, you know, you cannot always, you know.
Have you received any of these services? Like, have you received needle exchange services, condoms,
Absolutely, I always like to keep them out every week,
Narcan, HIV testing,
all your books.
mental health treatment, substance use treatment?
Yeah, I think it's that's.
What type of health services are most needed for people who are unhoused or unstably housed?
One thing, I think as people get older, the most important thing are dietary. You see a lot of people limping because they can no longer take care of their feet. The changing of the socks, the clipping of the nails. I think that's a really big as they get older and they're staying out on the street.
There's 3 medicine teams that meet people where
Definitely. You know, that's what people need because they're scared to go anywhere else because they can get arrested or the doctor's an extension or something. But if they have things like that are legal, that they know that it's kind of involved, the kind of rescue or having data, I'm sure a lot of them will really work for a time. Yeah.
I'm actually gonna go a little bit off script here. And to me, that video was just so impactful to hear those voices and just remark on what that made me feel. And while I'm saying it, please, I'd really invite you all in the audience, just write out how that made you feel in the chat. And really, to me, I just felt the stigma, the guilt, the despair that people have. I also really resonated with me the comment of that one person had about the right to use drugs and the right to use drugs in a safe space. And then the comments really around the rights to healthcare. And that made me feel a bit of shame because I worked in healthcare and time again, we provide such negative experiences to people who use drugs, where we should be a place of respite for people who have any illness, regardless if they use drugs or not. So at least that's what made me feel. I don't know if anybody else has any other comments. Somebody just wrote, othering and dehumanization stood out to them. Thank you, Peter. I'll just give a few seconds for people to gather their feelings and type them up. Okay. Well, as people type a few of these up, we're going to be segueing in a few seconds into the kind of question and answer portion of the webinar. Please, if you do have any specific questions, please type them out in the chat, and either you could read them out or I could kind of bring them up to topic. Thank you, Timothy. He just expresses that it's heartbreaking to hear their stories. Lamar, these feelings of wanting to be seen and heard. It's just really sad. Chelsea says that it really reminds her of former clients and witnessing the stigma and dehumanizations happening, making her really feel angry. Terry, good to see you, Terry. Really sad and shameful. The really reality of why our work is so important. And thank you for going on camera, Terry. Derek says that their time isn't valued. Definitely echo that. The person saying that they were there 14 hours, right, and not getting the services that they need. Okay. Well, thank you again. I know Kathy Reback was really one of the champions here in CHIPTS for getting this video done, and I know the Soma and Ellie and Ricky were definitely collaborators in getting this done, and so really I think it was so important to get those voices out. So I guess I can start off a few of the questions. As my son is saying that he likes water, but can you guys just talk a little bit about when you're working out in the field, what and kind of centering in this problem of housing that the webinar is really about, what are those main challenges that people tell you when they say, well, I'm here on the street, I'm here in a tent, I can't get housing? What are the X, Y's, and Z's of why they can't get housing?
I'll go first. I don't always think it's why if they don't have access to it. I think some folks are really scared to access housing because of the isolation. That's a really common feedback that we get, is that folks don't want to go into these spaces because they're being ripped away from their communities and everyone that they know, and they can't bring those folks with them into the space, and they don't always necessarily know where they're going.
I would like to say that it's more of trust. A lot of our clients do not trust the system. I think they've been promised for so long housing, and they're put into this system that whatever the system is, that never happens. So I think it's more of trust and not really believing in the system. Lost faith in the system.
And I think another part of it is that the sort of established systems that we have, the traditional systems for connecting people to housing, just aren't going out to meet these people where they are. They're not. They're expecting people to come to them, to their offices, and be ready to sort of fill out all this paperwork and have these conversations about all their needs. And a lot of these people are just not ready. They need someone who they can trust. They need someone who's going out there and having these conversations about not necessarily housing, maybe something else, but they'll gain their trust, and then maybe they'll be ready to have a conversation about housing and be ready to go into being housed.
Some of the issues that our clients have run into have been the overbearing rules and regulations that are placed on them when they get in someplace. They can't bring in Narcan. They can't bring in paraphernalia. They've got a curfew sometimes as early as 5 o'clock. And then from our non-HIV positive participants, they bemoan all of the services that are available to somebody if they're HIV positive. They don't happen to be, and so they feel left out.
I'm definitely going to echo all of these things. We see all of this. I think that one of the issues is that we have this monolithic approach to housing, and we expect people to conform to these systems that are highly barriered and are not specialized for specific people and specific needs. You know, speaking from kind of like a gender specific perspective, you know, a lot of the women that we're working with and trans women that we're working with are experiencing daily violence. They're being raped over and over and over again. They're being exploited, they're being sold, they're being beaten by partners, they're, like being held hostage by clients, they're in and out of prisons and all the different institutions. And the level of trauma is so extreme that it's just sort of like, let me get through to the next day. Let me get well. How can I get well? It's really hard to get well. And then, all of the different things that we do that makes it hard specifically for drug users around their lives, that like the overdose situation right now is also part of it. People understand that, they're in a tent next to someone that might actually save their lives where they are, but if they go into housing, are they going to be isolated and are they going to die as soon as they get into housing? And then, some of it is, it's so tricky and delicate that we're like sneaking people out of situations. And then when we sneak them out of situations, there's no bed. So, like in Los Angeles County, there's 15 beds that are designated for human trafficking. Like you can call all the DV lines and they will send you to more DV lines. So like people who are, oh, cool, call 211. They're going to get you a voucher. They're going to get you into a winter shelter. Then you call 211. You don't get a voucher. You don't get into a shelter. You get a bunch more phone numbers. So like what people are talking about as far as trust and mistrust of the system, it's because we have continually harmed people in hospitals, in clinics, in housing settings. And then retention is a major part of this, which, some of that, hopefully we'll talk about a little bit more later, but like Timothy was saying, how are people going to stay in a place where, they're expected to go outside to use, but then they're also expected to be back by 11 p.m. and not have any, paraphernalia or whatever. So they're like, they've got to go out on the street and hustle so that they can get well, but then they got to hurry up and get back home and not be too high, because if they're too high, then they're going to get in trouble for behavioral issues. So it's just like at every turn, we've created structures who continually push people out and away from services.
Thank you so much. Yeah, and definitely echo what everybody said. Is the experiences that we see with the work, what we do. One, Dara had a comment in the chat that there also are clients that need housing and they might have a place available, but because they might not be technically on the street, they can't use them. And Michael also, or they can't have access because they might not fit in whatever the rules of that bed is. And Michael also echoed that. And so if these are the major barriers in kind of your sense, how could we make it easier for people to get and then keep housing? Because that's something that happens as well, right? People get housing or get a tiny home or get a hotel room, but then they lose them, right? And so that contributes to the problem. And so could you just expand on, in an ideal situation, what would housing look like for you?
I think that's sort of the beauty of this Inside Safe program that the city just launched. Where the funding that we're using is city money. It's city general funds. It's not connected to the federal government or the state or the county. It really is city dollars that are being used to try to house people. All those rules don't exist with this program. We are sort of trying to work through all of this. The city's never done anything like this. The models that we have are the existing models that aren't working for people. So we tweak it. We do, we house people and then we tweak it as we see problems come up, because we understand that the way that we've been doing it all these years isn't working. So I mean, really, if we want to house people, we have to make it easier to get them into housing and to keep them in housing. It's as simple as that. I don't think it has to be complicated. We just need to make it easy for people to get in there and stay in there.
I'll speak to this briefly, and I want to kind of lift up a couple models that are being very effective here in LA County right now, and give some love to the people who are doing it. So there's Vagabond Hotel and DTLA Hotel are both women's specific spaces, and they are very low barrier. They have amnesty lockers for people to put, like their pepper spray or, their paraphernalia or their phone or whatever it is that they can't take in to housing. So it's this kind of takes away one of the barriers of like, oh, well, I can't even protect myself if I walk in and out of here. One of the great things that they're doing also is that there's no curfews and they're not exiting people if they're not showing up for 2 or 3 days. They're giving a lot of grace. DHS has been very instrumental in this and is kind of like pushing through a lot of what's going on. But I have to share some love for, Downtown Women's Center and Weingart that is working specifically in Vagabond, because it's very unique what they're doing and we're seeing it work. So right now we have, I think somewhere around 20 women that are in these 2 places, 16 of whom have been there since they opened. And we've never seen this before, like with any of our folks having that much retention. And I would say a big part of the retention is that there's no curfews and that they're not going to get exited if they're away for a few days. And if there's behavioral issues, they have case conferences with outreach workers and case managers and the people instead of just exiting. And when they exit, they're also expected to not exit to the street, but move them to another program.
And, oh, Ellie.
My feedback was really going to be to provide these interim housing locations around where people are already staying. A lot of people don't, at least here, like on the east side of LA County, a lot of people don't want to go to downtown LA. They don't want to go to South Central, and they're getting pushed to these areas. And they have long commutes on the bus. Nobody is like willing to go visit them. Allowing us as harm reduction providers to into these spaces, letting us set up, letting people have their loved ones in the room so that if they are going to use, there's someone there to respond if they overdose. And just having more transparency. I think a lot of folks are like in these spaces and they don't know what's going to happen from there. And they get removed from their communities and then they get kicked out for something really arbitrary and then they don't have anyone around.
I
I
would
guess,
like to, oh, sorry.
yeah, go for it, Terry.
I would like to echo what Ellie just said, because we are working in one of the Inside Safe programs. And what we noticed is just exactly what Ellie is saying, is that many of the clients that were actually in this one particular one that's actually in South LA, a lot of people that were residing there are from Venice. And it was some of the clients that we had met with that were from Venice when we were doing services in Venice. And so they leave every day, and then they're saying like, it's, we've been helping them with transportation and a lot of things because all of their friends and all the people that they hang out with is on the other side of town. And so they were saying how, although they're grateful to be indoors, it's really not convenient. So we go to some of the places and a lot of the people are gone because they're back in their areas of where they're accustomed and feel more comfortable at. So I do want to echo like what Ellie is saying. I think we have to be a little more mindful when we are bringing people in indoors, that is like within the area that they're most accustomed to.
And that is a topic of conversation in the planning meetings for Inside Safe. The problem that we're having is that there aren't enough hotels, motels, other locations where we can house people in the communities where they're residing. So we have to go further and further out. But we are talking about it and we're trying to find solutions to it. It's difficult.
Yeah, thank you for that. And I mean, echoing Ellie's comment around geography, right? For a lot of people who might have been exposed, say, to criminal organizations, moving to a different area of town could really put them at risk. So that's so important. And sometimes we don't think about that, right? Well, if you're hanging out on the west side and then you go to the east side, your life might be at risk. So super important. I still have a bunch more questions, but if anybody in the audience has anything that's lingering for you, please definitely write it out in the chat. I'm really super excited to have the organizations that we have here, because I know that you have been so innovative in the way you provide your services. Can you talk a little bit about kind of these new innovations in harm reduction and how you've been able to engage with people that you work with?
I mean, it's just a lot of trust building, right? And making sure that our folks are safe when they come here, or when we're out there, they feel safe around us. It's a lot of advocacy. It's a lot of learning from other harm reduction programs here in LA, around the world, learning from Europe. Yeah.
Also, I think it's really about whole person care and looking at the person as a person. Like today, for example, my staff, we're out, it's Father's Day this weekend, and it's, we're out, we have a big celebration. We're doing haircuts at a lot of our sites and making people, a lot of times when you look good, you feel good. And so it's really about like beyond of what the funders are saying, because the funders don't say do these things, but it's like we know it's these other things that we have to kind of be, like you're saying, innovative and really meeting clients where they are and really treating like the whole person. Because I think sometimes we just get caught up in the items or the safe things that we're providing them, but also meeting them on different levels, I think is so important.
So one of the things that we are known for is giving out cannabis for free. And we figured out that we could do this legally in the state of California. And, like we stay within the legal amounts that we're allowed to give out per person. And there was actually just a bill that was passed, SB 34, that creates a pathway for cannabis organizations to donate extra product that might be expired or whatever to nonprofits like ours. And a lot of it was around veteran services and, supporting PTSD through cannabis. So we are part of this coalition of people, which helps us kind of like protect ourselves in doing this thing, because we were afraid to start doing it in the beginning. And it's actually made us very, very popular with our participants, because we're known as like the weed fairies or the weed people. So, like we never show up at a new encampment and say, hey, what's up? Do you want housing? That's not how it works. We show up and say, how's your day? Would you like some weed? We've got lunches. Do you need needles? Do you need Narcan? Do you need, what do you need? Do you need wound care? There's a crisis situation. Let's deal with the crisis situation. So first it's like Terry and Ellie were saying, first it's the trust building. And then at some point, people might say, I want something different for my life. And that could be maybe that they want to go to treatment, or maybe they want to, be reunified with their family, or maybe they ask for housing, or maybe they say, help, I'm in a violent situation. Can you please get me out of it? So it never starts with like, what's the most complex intervention, or let's get you into housing. Let's clean the streets up. It's not like that for us. It's let's love on you. Let's build a relationship, love on you. And then we'll see, where you lead us to go. What do you want next? So autonomy is a big part of it.
Yeah, and I mean, I've seen it firsthand in one volunteer day that I went with Soma's team. Definitely the way your teams provide care on the street, you're well known. People are very happy, and you can engage them and then provide those different services that will reduce what, at least from our standpoint, from the HIV standpoint, will reduce the risk for HIV. So that's really incredible. And then I guess we're getting close to the top of the hour, maybe a few other questions. And so what, aside from the difficulties in getting people housing, what are other barriers to your work in general that you face, or what would be, how could we make, or how, I don't really have these kind of powers, but how for policymakers that do have these powers, how could they make your lives easier to do the work that you do that we know is so important to prevent HIV in the community. What's your wish list for Santa Claus, basically?
Well, so one thing that we're actively engaged in conversations on that I forgot to mention was safer consumption sites. So the city council did take a support position to have safer consumption sites in the city of Los Angeles, along with the previous mayor. We've been in conversations ever since then. Of course, everyone knows that the governor has vetoed those bills that have come to his desk. So we've been talking about ways that we could do it just on our own. It's not as simple as it sounds. So we're continuing to have these conversations. We, in the middle of all this, we got a new mayor, so we had to start those conversations with this administration because everybody's different at this point. So, and then we got a handful of new city council members. Half the city council turned over, so we had to start having conversations with those council offices as well. But we are actively talking to people, telling them what the program is, why it's important, trying to get their support, and then trying to build that foundation legally with the city attorney, with LAPD, to make sure that people coming into to those sites, people who are providing the services, aren't getting in trouble. So that is sort of ongoing. There is support among the new council members. It's just a matter of getting all of them to sort of come on board as well. But that's something that is on the sort of medium term goals that we have for this office, to start one of those sites, if not more than one, here in the city of LA.
I'll do a quick wish list. One of the things that we really hope for is dignified housing, both interim and permanent. So some of the things we're seeing is like the plumbing doesn't work. There's black mold. The ceilings are falling in. The elevators are broken. Management falls apart, shits the bed, and then there's no one for people to go to. People's doors get locked and there's no one to call. So then the fire department has to kick in a door, and then who's going to fix the door? Like something that we've seen a lot of that's really tragic is, security companies being very abusive of people in housing. And that includes harassment and rape and not intervening in violent situations. My wish list would be that if a security company is going to be contracted by a housing facility, that they would have to go through all the stringent training that the rest of us go through to make sure that we're providing dignified services, because a lot of these folks are also living in poverty themselves. They're underpaid, they're overworked, and they don't even understand the work. So they are resentful and aggressive to our people because they're not that far from the same position themselves, and they haven't received any training whatsoever. Let alone harm reduction training. That would be a unicorn. So, I think that, if all of us are going to work so hard to get people into housing, then housing providers have to work very hard with us to keep people in housing, including, having dignified spaces. And some of that is just money, that needs to be prioritized in certain spaces.
Awesome. Ellie, your wish list, anything at the top?
Really echoing what Soma and Ricky said, and then also to add to that is just decriminalization of drugs, opening those overdose prevention centers, decriminalizing sex work, and I wish we would just listen to folks and uplift their experiences and learn from them. They know what they want. They know what they need. Let's stop pretending like we know better than they do.
Well, thank you for that. And we definitely were listening. And I really appreciate your comments and what you've expressed today, because for many of us who are in the audience, especially who are researchers, these kind of comments are so important and affect people's lives. And we'll never get into a research paper, right? And to hear like guards doing the things that you've mentioned is just horrible and shouldn't happen, right? And so thank you for expressing that, and you definitely have been heard. So I want to thank everybody on behalf of CHIPTS and the Combination Prevention Corps. This is the second part of our series on housing. There's still a third part coming, and where we are hoping to invite policymakers and really figuring out, or people who study really policy on, well, how does housing policy need to really change in LA County to improve the housing situation. So please keep an alert out on your emails or wherever you get your CHIPTS information, be that social media. We'll be very excited to see you then. Again, thank you to Ricky, Soma, and Ellie. You guys are always so great. It's always such a pleasure to be in a room with you and really continue on with the great work that you do. And thank you to everybody in the audience that took the time to spend with us and hearing about harm reduction in housing.